Welcome to our 5 on 5. We're talking about coordinated care organizations in Jackson and Josephine County with Dr. Spencer Countiss, the chairman of both the Oregon Health Management Services Board and the Primary Health Board. He is furthest from me, and Dr. Philip Michael, the president and chairman of the La Clinica Board. Gentlemen, thanks for being here.
Thank you.
Thank you.
All right, so Spencer, let's start with you. What is a CCO?
A CCO is a coordinated care organization. It's a structure where all the different providers of care, the physicians, the hospital, social services, mental health, all get together to arrange the care and coordinate it for the patients in the Oregon Health Plan.
And what are the CCOs in our area?
There are two in Josephine County, Primary Health and All Care, and there are two in Jackson County.
That's right, Jackson Care Connect and also All Care.
Okay, all right. Philip, why is this change occurring? What's happening?
Well, the state is trying to make better use of their Medicaid dollars and trying to provide better care to their Medicaid patients in Oregon are covered under the Oregon Health Plan. Mm-hmm. And so the idea is to try and to get the care organized more at the local level than at the state level so that the local providers, the doctors, the hospitals, even the social service agencies, the mental health agencies, the local county health, can all cooperate together in a way that they haven't done before, hopefully provide better care, better access, and at a higher cost efficiency.
Now, is this, clearly it's something new to the state of Oregon, is this something new, are there any other states doing this?
I don't believe so. This is something that Oregon is really ahead of the curve on, and some states, I believe, have been trying to deal with their Medicaid problem if they have not as much money as they'd like by cutting their Medicaid rolls. Oregon is trying to solve the same problem by getting more efficient. Mm-hmm. And in fact, the federal government is excited enough about it that they've been willing to supplement the state to the tune of something like $500 million per year for the next several years. And it's not simply out of charity. The federal government thinks that they're going to save considerable dollars above that because, you know, the government subsidizes the majority of Medicaid care.
Yeah, all right. And Spencer, what are you hearing from people as they go about this change? Are people concerned about what this means for them?
Patients are concerned. Most of the Oregon Health Plan patients won't actually see any change whatsoever. All of this is going to go on behind the scenes. Some of them, especially the sicker ones, may get a lot more contact from their health organization, just trying to coordinate care and set everything up. But for the most part, the patients will get new cards for the health plan, but other than that, they really won't see much difference. And for the people who aren't on the Oregon Health Plan, it won't affect anything.
Okay. All right. Okay. Well, we're going to take a quick break, gentlemen. Thank you for being here. Stay with us. We'll be right back. Welcome back to our 5 on 5. Again, we're talking about coordinated care organizations in Jackson and Josephine County with Dr. Philip Michael, president and chairman of the La Clinica Board, and Dr. Spencer Countiss, the chairman of both the Oregon Health Management Services Board and the Primary Health Board. Phil, I want to start with you. What changes are you already seeing as a result of the coordinated care organizations?
Well, strictly speaking, the coordinated care organizations are going to affect this month and next month, but La Clinica is already doing the kinds of programs that we think will be carried forward under this coordinated care organization. One example is that we're participating in a pilot program to send community health workers out to deal with or into the homes of high utilizer patients who are repeatedly in the emergency room and the hospital, see what's going on, what social things, what mental health things, what medical things, why are they having so many problems? Mm-hmm. And we've already had dramatic success with several patients of decreasing their emergency room visits from literally several times a week to, you know, once a month or less, simply by helping them solve some social issues and mental health issues. Another program we've participated in, pilot program with one of the local hospitals, is that we've agreed to take responsibility for all of their acute inpatient mental health patients who are discharged who don't already have a physician. And within literally weeks of that, dramatically, more than 50% reduction in their readmission rates, and which of course saves the hospital and the community and money, but it also it impacts the lives of those patients themselves.
Absolutely.
So that's just an example of many more where that each community gets to decide how they want to spend their money, but those might be programs that they
Oh, fantastic example. Yeah, Spencer, we were talking about what else is unique about CCOs. It sounds like there's very broad goals here, some very different things.
Well, one of the goals is to try not just to improve health care, but to improve the actual health of the community as a whole. That's a very difficult thing to measure, but it's what we really want to accomplish rather than just more health care is actual better health. And so that's one of the specific aims of the whole program is to improve community health.
It's fascinating. Gentlemen, thank you both so much for being here. We appreciate it.
Thank you.
You're so welcome.
All right, stay with us. We'll be right back.